Nancy Pelosi said, "We can find out what's in the bill after it passes." I think that meant something different from what we sometimes think. The consequences of the bill are not in the bill. The bill sets up a centralized, powerful bureaucracy. That's one reason we have to study it to understand the consequences of the bill.
As part of the Affordable Care Act, starting in 2014, each of the 50 states is supposed to set up a state-based exchange, and the federal government has provided funds to help states establish these exchanges. Private insurers will sell health insurance in these exchanges so that people can choose the type of health care plan that they want. They're only there for individuals and small businesses. They're not there for employer-based coverage.
State exchanges supposedly will be centralized repositories of information about prices and services, insurance packages offered.
They call them online purchasing exchanges, which sounds sort of like, just go online and decide what you want and click and sign up.
The problem is that under the Affordable Care Act, there is the essential benefit plan. Any insurer is going to have to provide a plan that covers the mandates that the essential benefit plan of the federal government outlines. So it's going to be very, very difficult, I think, for insurance companies to offer plans that can be provided at a specific price that the government wants. It may well be that a lot of insurance companies will say this is not viable for us, so we're not going to offer plans in the exchanges.
People are not going to have choices, and they're going to be extraordinarily expensive, much more expensive than any health insurance any of us can afford right now. These are going to be mega bureaucracies that are going to want to know everything about us. They're going to know how much money we make, how many people are in our family, where we work, whether we smoke or not, what our health habits are, which health insurance plan we've decided to take. Are we eligible for subsidies, Medicaid, different programs? And remember, this is no longer optional. The federal law says you have to purchase health insurance under penalty of federal law.
It's not market-based, it's pretend market-based. It will drive out smaller independent insurance vendors and dealers, and it will centralize and control healthcare within a state. It's intended to centralize.
ACOs are accountable care organizations where doctors and hospitals are supposed to, under the Affordable Care Act, band together in order to reduce the cost of health care. Right now, 150 ACOs have been started around the country, and they're there for seniors. The goal being that doctors and hospitals would do global treatment of patients, which ultimately should reduce the cost of health care.
Accountable care organizations are an idea that sounds good on paper, but doesn't really work. On paper, it's saying, look, we're going to get people together and get various professionals together to treat patients in the most cost-efficient way. But the problem with the accountable care organizations is, number one, they get very big and the patients don't get the individual treatment that they want. And number two, they're trying to do low-cost, high-volume treatment. And that is not what we're looking for in medical care.
These are basically revisions of the old HMOs that the American people rejected in the 1990s. Seniors are going to be assigned to these ACOs, not choose them, but based upon which doctor they're seeing. If their doctor is enrolled in providing care through an accountable care organization, they're automatically enrolled. And they are not going to know that their doctor has an incentive to provide them with less care.
If a doctor and hospital in treating these patients come in at costs below what the accountable care organization, what the government thinks the cost should be, then they will be rewarded. If the cost of the care is over what the government thinks the cost should be, doctors and hospitals will have to pay back money to the federal government.
Maybe they come in, they've fallen, and he thinks, maybe I really ought to do a CAT scan to see if there's any damage here. But he's going to say, wait a minute, I'm going to get dinged if that happens, and I'm going to get paid less for Medicare if I send her to this test. Maybe it's really not necessary. Maybe we'll just wait until next time. All across the board, you're going to see incentives for doctors to provide less care, maybe against their medical judgment, because they're going to get paid less if their billing and their charges go over a certain threshold.
Low cost, high volume. That high volume is the disturbing aspect to patients. And that is run you in and out as quickly as possible, have you see the lowest level of education in your medical professional, and only if you sort of move up through and jump through the right hoops that you get to the doctors and get to see the specialists.
The American people in the 1990s rejected the HMO, the Health Maintenance Organization idea, because care was rationed, because the HMO provider wanted to get a return. The only way they could do that is by rationing care. And so I think the Accountable Care Organization is going to be a form of rationing to keep costs under control and to deny care, in particular starting out with our senior population.